Namaste, my dear brothers and sisters. Sorry for the delay. We were having some technical issues today morning. Aditi, I think you're not playing the video today, isn't it? No. So we'll just say a silent prayer in our minds and not play the devotional music to start with. Today's session is on vitamins and minerals. Vitamins and minerals we have clubbed together for reasons that we shall see soon. But one important thing we can keep in mind is that although they are required in very small amounts, they are important. They don't give us any energy, and yet they are important. Because if we have to create fire, then we need not only fuel, we also need a matchstick. So if we were to treat the carbohydrates, proteins, and fats as fuel, then it is vitamins and minerals that serve as the matchstick. So that's why we need them, and we can't really manage without even the vitamins and minerals. So with that, I can share the screen and go to the PPT. This is coming. Next slide. So it's like this. So before I start, the 11 blessings of the Mother and Sri Aurobindo to all of you from Sri Aurobindo Ashram Delhi branch. Among the traditional nutrients, we have already talked about carbohydrates, proteins, and fats. Today, we are going to talk about vitamins and minerals. And as you can see, we are almost at the bottom of the list. Now, why vitamins and minerals together? Firstly, they are required in small amounts, but small can be beautiful, and so we don't have to club them together just for that reason. Further, the intake of both these nutrients is based on common sense, assumptions, and guesswork. What I mean is that there's a large number of them, and the sources in the diet from where we get them have again a large variety, but they have something in common. Certain groups of foods provide us both these in reasonable amounts. And then we assume that if we have taken those classes, those categories of food in our diet, we must be getting enough of these. We don't in any way know whether we actually are getting that much. So it's only an assumption, and it is sort of a guesswork that if I take enough of this type of foods, probably I'll get enough of vitamins and minerals. Unlike in case of carbohydrates, proteins, and fats, where I know that if I've taken 2 chapatis which contain 50 grams of wheat, then this would have given me 5 grams of protein and 35 grams of carbohydrate. So there I know that much. But there's no way I can know that if I've taken this much of fruits and vegetables, I must have got this much of iron, this much of vitamin A, or this much of vitamin C. I do not know that. So the intake is based more on a sort of an intuitive sense that if I'm taking a good balanced diet, then I would also be getting enough of vitamins and minerals. Further, the sources from where we get vitamins and minerals are in common, and the single largest source are the fruits and vegetables. And this you would see now is something new, because while we were talking about carbohydrates, proteins, and fats, we kept talking about cereals and pulses, about edible oils, but we never talked about fruits and vegetables. Now you can see why they also have a place in the diet. Further, both these have no energy. They don't provide us any energy. So the energy content is just 0 calories per gram. Unlike carbohydrates, proteins, and fats, which provide us energy, carbohydrates 4 calories per gram, proteins 4, and the fats 9 calories per gram. Let's start with the vitamins. Vitamins are generally classified into 2 categories, fat-soluble and water-soluble. The fat-soluble vitamins are vitamins A, D, E, and K, and water-soluble, vitamin B complex, which includes a large number of vitamins grouped together as B complex, and they're all water-soluble, and vitamin C. The difference that it makes is that for absorbing fat-soluble vitamins from the gastrointestinal tract, we should have some fat present in the intestines. And therefore, it's generally recommended that they should be taken along with a meal or after a meal, whereas water-soluble vitamins can be taken anytime. They would be absorbed even if there's no other food present in the stomach and intestines. Further, the other difference that it makes is that if we take too much of the fat-soluble vitamins, in some cases, they could lead to toxicity. But in case of water-soluble vitamins, it's extremely unlikely because all the excess would be absorbed and promptly got rid of in the urine. So the extra vitamin intake will go in the urine rather than do us any harm. So this is sort of a general statement, although there could be some exceptions and also some caveats to it. But these are some of the implications of the fact that we have fat-soluble and water-soluble vitamins, why this classification is important. So these are the implications. When to take them in relation to a meal, and in which cases we should be more careful about the dosage because excess might do us harm in case of fat-soluble vitamins, whereas in case of water-soluble vitamins, that's extremely unlikely because the excess will just go in the urine. We'll waste it, but will not have any harm. Now let's start with vitamin A, the first amongst the fat-soluble vitamins. It's common knowledge to associate vitamin A with carrots. In fact, vitamin A is found in foods in 2 forms. One is as a precursor, carotene and its related compounds, compounds which are a close cousin of carotene. And in fact, carrots and probably carotene has been named because it is found in plenty in carrots. There are also foods which contain preformed vitamin A, that is vitamin A as such. So carotene is a precursor. You see something which we start with in the body and then the body can convert it into vitamin A. But now there is also some evidence that carotene and similar compounds could have an independent function apart from their function as vitamin A. Some of the carotene and similar compounds might therefore in the body stay as carotene. Part would be converted into vitamin A when both could have independent functions. And therefore, it's important that we take vitamin A not only from sources such as milk and milk products or meat and liver and egg yolk and so on, which will provide us preformed vitamin A, but we also get some vitamin A precursors from fruits and vegetables like carrots, because that could have an independent function of its own. So the sources of vitamin A and its precursor carotene are red, green, and yellow fruits and vegetables, particularly carrots, and milk and milk products, egg yolk, and among the meat products, the highest concentration is in the liver. Again, it's a fairly common knowledge that vitamin A has something to do with vision. And that is because it helps in forming the pigment which we have in the receptors in the eye. And the deficiency of vitamin A shows up in the form of poor dark adaptation. That when the person goes to a dark room, it takes much longer for this person to adapt to it and may not be able to adapt at all. But then more severe deficiency can also lead to other defects in the eye, which could eventually lead to blindness. And there was a time when preventable blindness among children was quite common because of vitamin A deficiency, but with mass sort of aggressive supplementation with vitamin A, that has more or less disappeared. But apart from its function in vision, vitamin A also has many other functions, And some of the important ones are that it is important for the health of all epithelial tissues. Epithelial, epithelium is the lining of the body organs. And to maintain that in good health, vitamin A is important. And if there's a deficiency, then this function would suffer, and that in turn may translate into things like cancer. So that's why vitamin A is important. Vitamin A also functions as an antioxidant. We'll talk about this in relation to some other vitamins, as well as next time when we talk about the other non-traditional nutrients. But briefly, why we need antioxidants is that oxidation is an important process in the body. It is through oxidation that we get energy from the fuels like carbohydrates and fats. But then there's a little price to be paid. There are byproducts of this oxidative process which could damage the cells. We call them reactive oxygen species or free radicals. To minimize this damage, there are antioxidant mechanisms built into the body. But those are apparently not enough, and therefore some antioxidant function is played by some of the items in our diet. And vitamin A happens to be one of those antioxidants which helps us minimize the damage due to these free radicals or reactive oxygen species. So vitamin A also has an antioxidant function. Then vitamin A is stored in the liver, which means that we don't have to worry about taking enough of it on a day-to-day basis. Further, if we take a good helping of carrots every day in the winters when carrots are available, that could be enough to take care of the carotene requirements or vitamin A requirements for the rest of the year. So you can stock yourself during the winters with plenty of carrots, and then you can forget about vitamin A during the summers. Now we go to the next fat-soluble vitamin, that is vitamin D. It's commonly called the sunshine vitamin because the skin has a precursor, something which precedes the formation of the vitamin D. We have a precursor in the skin. And that can convert that precursor, which is a close relative of cholesterol. Once again, we find that cholesterol is not a poison, as we talked last time. We do need cholesterol in the body. And one of the close cousins of cholesterol happens to be present in the skin. And when it is irradiated with ultraviolet rays coming from the sun, it gets converted into vitamin D. If we take vitamin D in the diet or in a capsule or a tablet, that also is further converted in the liver and then in the kidneys into the active form. So it undergoes a further conversion in the body before it is actually able to do its job of increasing the calcium absorption from the intestines. Now, coming back to the sunshine part, that it has been estimated that if a fair-skinned person exposes the hands and the face for 15 minutes a day, that will be quite enough to meet the requirements of vitamin D for one day. So one day's requirement can be manufactured by a mere 15-minute exposure of the hands and face, so far as a fair-skinned person is concerned. Now you can see that looks like a very brief exposure, but just come to think of your daily routine. Very often you'll find that even that much exposure is not there. Further, in India, many of us are not fair-skinned, and the result is that we need a longer exposure. And that is because the ultraviolet rays do not penetrate the skin pigment. The other things that the ultraviolet rays do not penetrate are the clouds, which means on a cloudy day it will not help. They do not pass through window glass, so we can't expose ourselves to sunshine coming through the window glass. That will not help. And skin pigment is also a barrier to these ultraviolet rays, which are required for the conversion. And the result is that vitamin D deficiency is in fact fairly common. All the same, is it as common as it's sometimes made out to be? And whether we need those heroic doses of vitamin D supplements, which are the norm today, that is controversial. But all the same, the fact is vitamin D is an important vitamin, and we could get deficient in spite of its being readily available by exposure to sunshine. The dietary sources are milk, eggs, liver. We do not have vitamin D in plant products. Now, the function of vitamin D is to help us absorb calcium from the intestine, and it also helps in the deposition of this calcium in bones. It is stored in the liver like vitamin A, so once again we can stock on it, and that is the rationale behind the heroic doses, which have become pretty common now, that if you do that for a few weeks, then you are taken care of for the rest of the year. Deficiency leads to rickets in children and osteomalacia in adults. Technically osteomalacia, but then osteomalacia and osteoporosis could be closely related. And what is of greater public health importance today is perhaps osteoporosis, and we'll come to that a little later. Excess of vitamin A as well as excess of vitamin D could lead to toxicity, and this is important to keep in mind because vitamin D in heroic doses is very common, and the patient himself may follow the logic that if something is good, more will be definitely better, and overdo even the dose that has been prescribed, go beyond even the prescribed dose. That should not be done. Then vitamin E. Vitamin E, with relation to vitamin E, we have gone through many fluctuations in medical knowledge, from being considered important or completely unnecessary for human beings. We now have reached a point that yes, we do need some vitamin E, and its main function is as an antioxidant. The primary sources are vegetable oils, and it seems to also prolong the shelf life of unsaturated fats. And again, it speaks of the wisdom of nature that the more the polyunsaturated fat content of an oil, the larger is its natural vitamin E content. And therefore, the greater requirement of vitamin E when we take unsaturated fat, which also increases antioxidant requirements because unsaturated fat is unstable outside on the shelf and also inside when it gets incorporated in the cell membranes. So both places, it is vulnerable to oxidation, the polyunsaturated fat, and at both places vitamin E could help outside on the shelf as well as within the body. The deficiency of vitamin E is extremely rare. In spite of all these facts that we are talking about, it is required, it is important, but all the same, real deficiency is extremely rare. However, under the impression that it is an important vitamin and that it may be important for reproductive health and it may also slow down aging, for a few decades, heroic doses of vitamin E were being promoted through supplements, but that wave has now died down, and it has been replaced by the new wave for vitamin D. Now, the last fat-soluble vitamin, vitamin K, is found in green leafy vegetables, and it's also manufactured by the bacteria present in our intestines. However, the supply from intestinal bacteria is somewhat unreliable, and we can't be sure about it, but all the same, it does make some finite contribution to our vitamin K intake, apart from the green leafy vegetables. Vitamin K is utilized in the body for manufacturing a protein called prothrombin, which is important for the coagulation pathway. So that's how it helps in clotting of the blood, and clotting is important to stop bleeding from an injury. And therefore, although the deficiency of vitamin K is rare, if it is present, it may lead to a tendency to bleed. And this we are becoming more and more familiar with in relation to another disorder, dengue, in which platelets are deficient and the person has a tendency to bleed. Something similar happens due to vitamin K deficiency. Although vitamin K deficiency in the diet as such is extremely rare, it could be the result of antibiotic treatment because they would kill the intestinal bacteria which are contributing to our vitamin K intake. And it could also come because of some drugs which are used for preventing coagulation in the blood. And these then compete with vitamin K, and the result is that there could be reduction in the manufacturing of prothrombin. And while they are being used as blood thinners or for preventing coagulation, which could lead to heart attacks, etc., those drugs could also induce a vitamin K deficiency indirectly. So those are the situations in which a person may get vitamin K deficient, but as such, vitamin K deficiency is extremely rare. Now we come to the water-soluble vitamins. Vitamin B complex is a large number of vitamins, whole family of B vitamins, but we'll talk about only a few of them, which may be a little more important because the deficiency does occur, and there are some important, interesting details in relation to them. Let's start with B1 or thiamine. The chemical name is thiamine. Mild deficiency of this vitamin may lead to depression, confusion, mood swings. Now, this could be important because this type of psychological symptoms are becoming important. And apart from purely psychological issues, they could be because of vitamin B1 deficiency, as could these symptoms be also the result of reduced thyroid function. So there could be some physical causes for these psychological symptoms. But that doesn't mean that we should try to treat this type of symptoms by taking thyroxine tablets. That would be risky. But we can certainly try to take care of these by taking a little extra vitamin B complex. That is not risky. As we saw, if you take an excess of water-soluble vitamins, it will go in the urine. So a moderate excess of B complex will not do us any harm, and therefore it may take care of some of these psychological symptoms. Severe deficiency leads to beriberi, which could be dry, giving symptoms on the skin, etc., or it could be wet, leading to heart failure eventually, and could also lead to death. Vitamin B1 is found in the food grains, apart from fruits and vegetables, but one of the primary sources are food grains. But then in food grains, you'll find one thing which can be generalized. Much of the vitamins and minerals in the food grains are actually concentrated in the seed coat. That is the outermost covering of the food grain, which also has fiber. So the outermost covering not only gives us dietary fiber, which we have talked about in considerable detail earlier, it also provides us vitamins and minerals. So the outer seed coat is important, and therefore that's another important reason why we should take whole grains. And some of the early research on vitamin B1 was exactly along these lines. It was found that beriberi was very common in those who were subsisting almost exclusively on polished rice. And then experiments were done on animals in which one group was fed this type of polished rice diet, and another group whole grain, that is rice which had its seed coat intact, brown rice, and yet another group in which the white rice had been supplemented with rice shavings, that is, or maybe another group in which there was some other diet, again supplemented with the rice shavings. So the overall conclusion of all these was that the animals which got the rice shavings or the rice grains with the seed coat intact could escape beriberi. So the conclusion was that this seed coat has something to do with it. But then what was the conclusion that Eichmann, the person who did these experiments originally, what was the conclusion that he drew from it? Today it looks very obvious. He should have drawn the conclusion that the outer seed coat has some nutrient which is required for the body, and if it is deficient, then it leads to beriberi. But that was not his conclusion. He arrived at a more convoluted conclusion, which was also logical, and his conclusion was that polished rice has some toxic component, has something which can do harm to the body and lead to beriberi, and that this harmful substance is neutralized by something else present in the outer seed coat or the rice shavings. Now, this is a more convoluted conclusion, but once again, quite logical. His conclusion was that this substance present in the rice shavings is able to neutralize something harmful which is there in the white rice. Why did he draw this conclusion? Because till then no other vitamin had been discovered, and therefore the idea that something missing in the diet could lead to disease was not a part of the way the scientists used to think. On the other hand, a large number of germs, some of which produce toxins, was known. So we knew that the entry of a harmful germ or the entry of a toxin produced by a germ into the body can lead to disease. So the main line of thinking, the paradigm of thinking among medical scientists was that disease can be caused by the entry of something harmful into the body. So that is why he assumed that through white rice, something harmful is entering the body, and that the rice shavings or the seed coat of the rice is able to neutralize that toxin, is able to neutralize that poisonous substance. So you can see that from the same set of data, you can arrive at alternative conclusions. And the conclusion that we arrive at is maybe logical, but logic itself can lead to more than one conclusions. And the conclusion that you accept and the conclusion that you reject is somewhat arbitrary and could be influenced what the current paradigm is, or in more sort of ordinary language, the way it is fashionable to think in that period of history. So the way it is fashionable to think is the way the scientists also tend to think. And now, leaving that historical snippet aside, let's go to vitamin B2, riboflavin. It is yellow colored, deep yellow colored. And that is why if you take a tablet or capsule containing the B complex, one can get deep yellow urine. That happens because excess of riboflavin is going in the urine, and that is what colors the urine yellow. So it's yellow urine is not necessarily because you're not taking enough water, particularly in summers, although that is an important reason. And one should keep it in mind that it doesn't happen very deep yellow even in summers, because that could then lead to stones in the kidneys. But urine can become yellow also after taking a B complex tablet because of the presence of riboflavin. And the deficiency leads to cracks at the corners of the mouth, a sore tongue, a tongue that feels very uncomfortable and somewhat painful and is more red than usual. So that's why a person has any of these symptoms or some ulcers in the mouth. One of the harmless things that doctors prescribe routinely is vitamin B complex, particularly thinking in terms of providing enough of vitamin B2 or riboflavin. Why they give a multivitamin supplement or a B complex instead of giving the specific vitamin which is required for that particular condition is because these deficiencies tend to go together. Since they are found in the same types of foods, the sources for all these are similar. If a person is deficient in one and has florid symptoms because of that, chances are that the person also has some sort of a subclinical deficiency of other vitamins also. So that is why we tend to give all of them together rather than give them individually. The major sources of vitamin B1 and B2 are whole grains. Now we come to two more members of the B complex family, folic acid. As the name itself indicates, folic acid is found in foliage, that is green leafy vegetables. And deficiency leads to anemia. Anemia of a type that is different from iron deficiency anemia. The difference is quite obvious if one looks at the blood film under the microscope. And further, folic acid deficiency may also lead to some birth defects if a pregnant woman suffers from B complex deficiency, and therefore folic acid is one of the vitamins that is more or less routinely given as a supplement to pregnant women. Folic acid deficiency is fairly common in India. Unlike B12 deficiency, which is the next vitamin, which also leads to anemia, which looks somewhat similar to folic acid deficiency, if you examine the blood under the microscope. And to some extent, B12 deficiency also responds to folic acid. But then one of the important precautions to be taken is that one does not treat vitamin B12 deficiency with folic acid, because folic acid will correct the anemia to some extent, but it will not prevent the neurological damage which can take place because of B12 deficiency. So B12 has a function, important function, not only in manufacturing enough blood cells, it is also involved in the proper functioning of the nervous system. And therefore, if a person complains, say, of tingling in the limbs or anything which suggestive of peripheral neuropathy, that is some sort of a disorder of the nerves which are supplying the limbs, arms and the legs, that's why it's called peripheral neuropathy. So a person complains of any such thing, One harmless thing which the doctors routinely do is to prescribe a cocktail of B1, B6, and B12. Because B1 we saw, thiamine also has something to do with the nervous system. B6, pyridoxine, also has something to do with the nervous system, and B12 also. So give all of them together. As a tablet, as an injection, depending upon the severity of the problem. So B12 deficiency should be treated with B12. Otherwise, we may be deceived by the response of the anemia just by giving folic acid. And therefore, you find that once again, many preparations, in fact, have all of these together. The same thing has folic acid, B1, B6, B12, vitamin D. We tend to cluster them together in different supplements, primarily because the sources are similar, and therefore deficiencies could also go together. Some of the deficiencies may be easily visible, some may be subclinical. They have not risen to the surface. So the visible deficiency is only the tip of an iceberg. The remaining iceberg is the marginal deficiency of other nutrients found in the same food groups. Now coming to vitamin C, the last among the water-soluble vitamins. I have listed here these among the sources, oranges and lemons, which everybody knows are the major source of vitamin C, the last. I have listed them the last, particularly because that is not the only source of vitamin C. In fact, much of our vitamin C in the diet may come from other sources, particularly green leafy vegetables. Because we take green leafy vegetables, or at least can take green leafy vegetables, much more regularly than oranges and lemons. Now, then why this myth? It has two reasons. One is the historical fact that initially sailors who got scurvy were treated with fresh lemons. They carried some fresh lemons on the voyage, and by taking that, they could prevent scurvy. The historical reasons. The second reason is somewhat commercial in nature. There's a powerful lobby for California oranges. And they have succeeded in creating this myth that unless you take enough of oranges and maybe their close cousins like lemons, you'll never get enough vitamin C. But you can, even without taking oranges and lemons regularly. And peas and papaya, in fact, are among the richest sources, and so is amla, which is also a constituent of Chyawanprash. So there are multiple sources of vitamin C, but why we may still get deficient is one reason is that's a heat labile vitamin, which means that if you cook something which has vitamin C, very little of it may survive. Which means that we should, for this, take as far as possible some uncooked fruits and vegetables. And of course, if we can take amla on a regular basis, as amla powder, as amla murabba, or as Chyawanprash, fine, even that will serve the purpose. And of course, oranges and lemons are perfectly acceptable foods. As and when available and you feel like taking them, you can take those also. Deficiency leads to bleeding, particularly from the gums, but also in joints, and could lead to therefore painful joints and under the skin, forming small red, streaks. So deficiency leads to bleeding. There are several stories around vitamin C which can be interesting. And today we do have time for a little of those stories. James Lind was the person, a Scottish physician, who can be considered to be the first in modern medicine to have performed a proper controlled experiment to see what is it that actually helps in preventing scurvy among sailors. Sailors, were on the sea for months together. Fresh food was difficult to carry, so they survived on food which could be easily carried, which naturally didn't include fresh fruits and vegetables, and therefore they got scurvy, bleeding from the gums, and sometimes scurvy can reach a level where it can also lead to death. And there were voyages in which, one historical voyage in which as many as 1,400 sailors died on the ship out of the 1,900 who were present on the ship. So it was that severe a problem. So what he did was he performed a proper controlled experiment. Intuitive feeling that oranges, lemons, and some fresh fruits and vegetables might help was already there. But then he did a proper experiment in which he had one group which got some fresh lemons and another groups which got what may be called control, which had some similarities with it. For example, anything sour, like vinegar. And some got plain water, and so on. So there were 5 groups we had, and they all got different things which could have something to do with with some similarity to vitamin C, or which could serve purely as a control, like say water, plain water, as a pure control. And it was found that it was only those who got oranges and lemons who could completely prevent scurvy. To some extent, it happened also with those who got cider. Cider was a type of fruit juice. So those who got that, they also, to some extent, prevented scurvy. The rest of the groups could not. So that's how we proved that oranges and lemons have something which can prevent scurvy. Another person closely associated with vitamin C is Linus Pauling. He was a chemist. He belongs to a relatively recent history. And he is the only person who got an unshared Nobel Prize twice, once for chemistry and another for peace, because he was also a peace activist. But then this very peaceful man was very aggressive in promoting vitamin C. And he believed in what he said. So he himself took heroic doses of vitamin C every day regularly. Whether it was because of that or irrespective of that, he did live for 93 years, as you can see. He lived a long life. But then he also ended up creating many controversies around vitamin C. Whether we need that much vitamin C, he said everybody should take at least 200 milligrams of vitamin C a day. But at least the current consensus is that about 50 milligrams would be quite enough. But then he was the one who said at least 200 milligrams for everybody every day, and larger amounts for preventing common cold, something which continues even now because it's quite harmless. So 500 or milligrams or 1 gram of vitamin C a day, 1 gram would be 1,000 milligrams. So 500 milligrams or 1,000 milligrams of vitamin C for a few days doesn't do any harm. And if given early in the common cold, there's a possibility, there's some evidence it may reduce the severity at least of the symptoms. So that much sort of a legacy has left behind. But all the same, the heroic doses that he promoted and the heroic doses that he took probably are unwarranted. And could the excess be in any way harmful? Not in a major way, but at least there are 2 ways in which this excess could be harmful. One is, that if we take a large amount every day, partly from the diet, partly from supplements, then the person's body gets accustomed to that large supply. And therefore, now if this person stops the supplement and goes back to the normal intake that is possible through fresh fruits and vegetables, the person may actually get deficient in vitamin C. It's something like if you have a large income and suddenly the income comes down to 25%. You may still be getting more than what a poor person gets, but then it's a hardship for the person who was accustomed to 4 times that much. So that's what happens in case of vitamin C. Also, the person is more likely to get deficient if the person has been taking a large amount for a long time. The second thing that can happen is that it can lead to an increase in the formation of some type of stones in the kidney, oxalate stones. So it can increase the risk for certain types of stones in the kidneys. So these are some of the possible harmful effects of a large excess of vitamin C. But reasonable excess for short periods is certainly quite harmless. It just goes in the urine if the body doesn't need it. And Linus Pauling was one of those who promoted it, and some of his legacy still continues because vitamin C is routinely given and people even take it on their own. They know it that if we take a little vitamin C during common cold, it might be helpful. And something similar actually also holds for Chyawanprash, which is more than vitamin C. And the excess or the extra items that we have in Ayurvedic preparations like Chyawanprash may not be entirely useless or redundant, because they could have some subtle functions. They could perhaps increase the bioavailability of the nutrient. Major nutrient may be vitamin C, but its bioavailability might increase. It might provide other things which can act in a synergistic manner. Vitamin C is an antioxidant. It could have other antioxidants and they could act in a synergistic manner. It may help reduce some of the side effects of some other component in the preparation. So these are subtle effects which these multi-component preparations of the type that we have in Ayurveda may have something. In contrast with the approach of modern science, which tends to be reductionist in its approach and concentrates on the active principles. In this case, the active principle is vitamin C. So only vitamin C, why anything else? No, that is the approach of a person trained in modern medicine. But then both have their value. value, both have their value in the sense that if a person actually has vitamin C deficiency, probably you're able to correct it much faster by just giving a large amounts of vitamin C itself. Or if a person has a sore tongue and cracks at the corner of the mouth, you'll be able to treat it very promptly with B complex, more easily with B complex than with an Ayurvedic tonic, which has many components. So for quick action, specific action, yes, this approach does help. But then on a long-term basis for prevention of disease in general, perhaps a multi-component type of approach as we have in the Rasayan Shastra in Ayurveda, that may be more relevant. So that was Linus Pauling. Then Norman Cousins, more or less a contemporary of Norman Cousins. In the 1960s, he was part of an American delegation as a highly educated man and a peace lover. Norman Cousins, by the way, is also the author of a biography of Mahatma Gandhi. So he was a peace lover. He was sent during the days of the Cold War, which was more or less at its peak in the 1960s, to the United States. He was sent to Russia by the United States. He was a part of an American delegation to talk about disarmament. You might remember those SALT talks, strategic arms limitation talks. So he was a part of that delegation as the leader of the delegation. He had a very busy time there, some stress also, and particularly the return journey ended up due to some unforeseen events, extremely hectic. And by the time he was back home in the United States after that hectic journey, he came down with an attack of ankylosing spondylitis, which is an autoimmune disease. Painful, and only 1 in 500, he was told, survive, the rest die. Now, he was admitted to the hospital and he was being given primarily painkillers for the pain that he had. And the doctors confessed that they didn't really have anything specific to offer for this autoimmune disease. That is a disease in which the immune system is harming some parts of the body itself. That's an autoimmune. That is, the body is harming itself. The immune mechanisms have gone wrong. Instead of working against germs, now this immune system is working against some parts of the body itself. So that was Norman. So this person, Norman Cousins, he went through this hectic journey towards the end of his stay in Russia, and he came down with ankylosing spondylitis when we reached home, and he was getting these painkillers. Being an educated man, he started reading about his disease, and he discovered that the adrenal glands were important for the health of the immune system. One of the important components of the adrenal glands was vitamin C, and therefore adequate amounts of vitamin C were important for keeping the adrenals in good health. And then he also discovered that the painkillers that he was getting would deplete the body of vitamin C. They would drive vitamin C out of the body. So through some sort of a rough logic, he worked out that these painkillers that I'm getting are helping me get some relief from pain, but actually they are also doing me harm by getting rid of vitamin C and thereby endangering the health of my adrenals, which in turn are important for the immune system, and I have a disease of the immune system. So instead of repairing the immune system, I am doing damage to the immune system through this treatment with painkillers. So he had a talk with his doctors and he told them that I want to stop the treatment, I can tolerate the pain, and I want to get discharged from the hospital. He got discharged from the hospital, and then he reasoned out intuitively that perhaps it was the stressful stay in Russia that has given this disease. And for that, again, there was some evidence from Hans Selye's experiments done in the 1950s. He got this disease in 1960s. In the 1950s, some evidence had been accumulated that mental stress could lead to an impairment of adrenal function and consequently immune function. So he thought that if stress could give rise to the disease, will not happiness help in getting rid of the disease? Very simple question, very simple logic. But the doctors had forgotten to ask this question in the 1960s. And therefore, this person who was not a doctor had that uncluttered mind and a brilliant mind, of course, which asked this question: if stress could give rise to my disease, will not happiness be able to reverse the disease? So instead of staying in the hospital, he got admitted to a hotel, which was more pleasant and less expensive. And he got a hold of a large number of videos. Those days, the video cassettes and all were there. That was the only way he could entertain himself with whatever he wanted on the television set available in the hotel. So he started watching comedies. And being an educated man with a scientific bent of mind, he collected evidence that 10 minutes of laughter gave him pain-free existence for 2 hours. And by the time he got discharged from the hospital, he was quite convinced. So not discharged from hospital. By the time he left the hotel, he was quite convinced that laughter is actually helping. And along with that, why we started the story was because of vitamin C. Because he had reasoned out that my adrenals are getting depleted of vitamin C through the painkillers. He said, I've stopped painkillers, but what about the depletion that has already taken place? So he started taking heroic doses of vitamin C to replenish the vitamin C which he had lost. And how much vitamin C did he take? Up to 25 grams a day, which means that you can really take heroic doses of vitamin C without any apparent harm for short periods. So he took up to 25 grams of vitamin C in a day and watched these comedies and literally cured himself through a combination of laughter and vitamin C. And unlike Linus Pauling, who was a champion for vitamin C, Norman Cousins didn't become a champion of vitamin C. He started championing the cause of laughter or happiness and became one of the major sort of people who ushered in the era of mind-body medicine. That is, the mind has a lot to do with health and disease, and became the first, perhaps, non-medical person, non-medical scientist to have a single author paper in the New England Journal of Medicine on this subject. And one of the very few non-medical people who were invited by this medical college associated with the University of California at Los Angeles to occupy a faculty position there. And what did he do during that period when he had that faculty position? He tried to promote as much as possible research on the mind-body connection. And it was soon found, as an extension of whatever little work was available from Hans Seeley, that mental state, the psychological state, could have an important bearing on the immune status. As an extension of that, more detailed experiments were done. And by and large, they all supported that when we are happy and at peace, our immune system gets stronger. And when we are under chronic stress, the immune system becomes weak. So by showing this connection between the mental state and the immune system, he ended up giving birth to a new science, a new branch of science, which is today called Psychoneuroimmunology. That is the psyche, the mind, working through the nervous system to affect the immune system. And he's now considered the father of psychoneuroimmunology, and the Psychoneuroimmunological Research Society of the United States, which has an annual conference, always has in that conference a Norman Cousins Memorial Lecture. So that was Norman Cousins, who used a lot of vitamin C for treating himself, but went on to become the father of this new discipline, psychoneuroimmunology. In a way, you can say one of the important persons who ushered in the era of mind-body medicine in modern medicine. So these were some stories around vitamin C. Now we go to minerals. Iron. The function of iron, as we all know, is as a constituent of hemoglobin, which is there in red cells. And when the red cells are deficient, a person could get anemia. The major sources of iron in the diet are green vegetables, fruits, whole grains, and legumes, and also non-vegetarian foods like eggs and meat. We will spend a little more time on iron, because iron deficiency anemia, in fact, is the commonest anemia in India. And it need not be so. All the same, among especially pregnant women and lactating women, the requirement can go up enough that it may be difficult to meet that requirement through the diet, and therefore supplementation with iron may be called for. But once again, heroic doses are given which may be totally unwarranted. Iron, you see, is one of the most carefully conserved nutrients in the body. The body guards it with great effort so that hardly 1 milligram is lost per day in the urine, and women lose a little additional amount during periods. So they may lose 2.5, 3 milligrams of iron a day on an average. During pregnancy and lactation, menstruation stops, but then the requirements of the baby increase the requirement above the non-pregnant state. Now, this small amount of iron, say 1 to 3 milligrams or 1 to 5 milligrams of iron, this requirement does not get satisfied with 1 to 3 or 1 to 5 milligrams of iron because of its poor absorption. The absorption may be only 10%, which means to get 2 milligrams, one might have to take 20 milligrams of iron. The absorption on the whole is better from non-vegetarian sources than from vegetarian sources. But all the same, one can compensate for it by taking a larger amount of vegetarian food, which has has iron. But then why it's important to keep this in mind is that very often the amounts that are given are in terms of 100 milligrams or 200 milligrams of iron a day. What happens when we give this excess iron? What happens is it stays in the intestines. It does not get absorbed because the absorption is to some extent dependent upon the needs. When we need more, we absorb a little more. When we need less, we absorb less. So this person is being supplemented. The needs are being met very well, and therefore the absorption is less. All the excess is left behind in the intestines, and iron can give gastrointestinal effects. Some get constipation and some get diarrhea, and the evidence for it we see in the blackening of the stool, which means that this excess is being lost in the stool. It's giving the person gastrointestinal disturbances, either constipation or diarrhea, and all because an unnecessary large amount of iron is being given to the person. Now, what is the way out? Because it's difficult to find a tablet which has less than 100 milligrams of iron. One solution is that instead of a tablet, take syrup, because in the syrup you can control a dose. One popular brand of an iron-containing syrup provides about 35 milligrams of iron from 1 tablespoon. So if you assume say 10% absorption, you can take 1 tablespoon a day, and for better absorption, divide it into 2 doses, half a tablespoon twice a day, and because of the gastrointestinal effects, take it after a meal. That is the usual dictum in iron. So take half a tablespoon after lunch and half a tablespoon after dinner, and your iron requirement, all deficiencies taken care of. And if the person is not having that much requirement, then even just half a tablespoon once a day may be enough, because you can regulate the dose depending upon how much iron you actually want to take, which you can't do with a tablet easily. So therefore, that is the advantage in turning to a syrup, which is primarily meant for children, but adults can also take it. Now coming to calcium. Together with vitamin D, it's required for healthy teeth and bones. Now this is common knowledge. The way it happens is that both are important, because while we need calcium for the teeth and bones, to absorb calcium properly from the intestines and to deposit it in the teeth and bones, we need vitamin D. The sources of calcium are whole grains, especially ragi, which is a high calcium cereal, and milk and milk products, and water, interestingly, because water itself can also be a source of a considerable amount of calcium. Along with other electrolytes, water also has some calcium. As in the case of iron, once again, the absorption to some extent depends upon the requirements of the body. When we need more, we absorb more. When we need less, we absorb less. The deficiency, therefore, of calcium itself is very rare, but because vitamin D deficiency is relatively common, it can lead to an apparent calcium deficiency. So the way out is take enough of vitamin D. By and large, calcium will take care of itself. And excess of calcium could be harmful once again, because there's some evidence that taking too much calcium could increase the frequency of heart attacks, increase the risk for heart attacks. And that we know is possible, because if the blood level of calcium goes up, exposure to a higher level of calcium in the blood can induce contraction of muscles, and these muscles could include the muscles in the walls of the coronary arteries. So that would be the sort of logic how excess of calcium is possibly precipitating heart attacks, leading to a spasm of the coronary arteries, a sudden contraction of the coronary arteries, superimposed on a partial block, as we talked the other day, which can happen in a person above a certain age. Everybody has a partial block, and if anything is done which will precipitate a sudden contraction, it could lead to a heart attack. Iodine is another important mineral which is required by the thyroid for manufacturing thyroid hormones, and the deficiency may occur. It used to occur very commonly in the sub-Himalayan belt in India because the soil there is deficient in iodine. Plants can grow quite well even with very little iodine, and therefore the plants will grow, but those plants, when consumed by the population as food, do not provide enough iodine to the person. And that's how a large number of people in those regions, the sub-Himalayan belt, got iodine deficient. The thyroid function suffered, and the result was they had enlarged thyroids or goiter. And this has more or less disappeared after the introduction of iodized salt. Whether iodized salt is absolutely essential for preventing thyroid problems, or whether rock salt will be able to solve the problem because rock salt has iodine, that can be debated, which is easier. On the whole, it appears that as a public health measure, probably universal iodization of salt is a more cost-effective of doing it, because salt is one thing which everybody, rich and poor, takes in predictable amounts. Nobody will ever take too much to get toxicity, and therefore, to provide it to everybody, universal iodization of salt is a simple solution. And those who are not deficient, if they take a little extra, probably it will do them no harm. At least there's no evidence that it does them any harm. So the public health measure, introduction of iodized salt, has been one of the success stories of modern medicine. So to sum up, why vitamins and minerals were clubbed together was because they come from a similar cluster of foods. And the important foods are whole grains, because vitamins and minerals tend to be concentrated in the seed coat, not in the interior of the grain. So the grain becomes useful as a source of vitamins and minerals only if we take it whole, as nature packed it, with the seed coat intact, which means brown bread, brown rice, and other whole grains. Vegetables and fruits, particularly green leafy vegetables, GLV, stands for green leafy vegetables. Milk and milk products, and if one is a non-vegetarian, then egg, meat, and particularly liver for vitamin A, D, and B12. We have talked about grains earlier, and milk and milk products, to some extent, we'll talk about when we come to balanced diets. Today, let's see how much of vegetables and fruits should we take. As a rule of the thumb, about 500 grams a day, which we can get from 4 to 5 helpings a day, assuming that each helping is about 100 grams. Some people have argued that in India, our requirement may be a little less because our diets are predominantly vegetarian and have a large amount of plant foods, and therefore we may not need that much of fruits and vegetables. But certainly taking 4 to 5 helpings will not do any harm. It's not impossible. So if a person takes one salad and one cooked vegetable at lunch, and the same at dinner, one cooked vegetable and one salad at dinner, or skips salad at dinner and instead takes a fruit mid-morning or sometime in the evening, that will give us easily 4 helpings a day. But then why do people not eat enough of fruits and vegetables? Because again, there is enough data to show that while people may be only marginally deficient in protein or fat, particularly protein, they may be marginally deficient. They may not be taking enough of dals, for example. But when it comes to vegetables and fruits, the deficiency is really severe. While the intake suggested is about 500 grams a day, a very large population takes not even 100 grams a day. One reason could be that this is one of the expensive items in the diet, particularly fruits. And therefore, I've clubbed fruits and vegetables together. From the nutritional point of view, they are not very different. They're both more than 80% water, and they have similar components. So major difference is that vegetables are taken cooked, fruits are taken uncooked. But that's only a partial sort of a distinction. There's an overlap. Some fruits can be cooked. On the other hand, vegetables like tomato can be taken, and many other salad items can be taken without cooking. So that is not an absolute difference. And therefore, from the nutritional angle, vegetables and fruits can be clubbed together, and 4 or 5 helpings of either of these put together would be enough. But all the same, it is an expensive item in the diet. But even those who can afford it do not take enough of it for a variety of other reasons. Firstly, it is not the most palatable part of the diet. And therefore, if we are guided by the palate, we will not take enough of fruits and vegetables. The second is that they take time to eat. One has to work hard on chewing them, and therefore they take time to eat. They take effort to eat. We don't want to spend that much time and effort on eating. And that's a pity, because we should eat slowly, mindfully, and give enough time. Chew the food well. That is helpful for many points of view, as we saw also in controlling the level to which the blood sugar will rise after a meal. If we eat slowly, it will not rise as much as if we eat fast, apart from what the diet contains. And another thing is it helps in reducing overweight, because it has been seen that after a person has eaten for about 20 minutes, the person generally starts feeling full, irrespective of how much energy the person has consumed at the meal. So if you take 20 minutes to eat less food, that is, you eat slowly, you will be full, and the chances of overeating become much less. And if that was further, extra time was taken because of the time and effort taken to chew fruits and vegetables, which provide very little calories. Not only one will eat less because you have eaten less quantity of food, it will also reduce because you have taken low calorie foods like vegetables and fruits. And that's how it's good to spend that time. But then, because they take time and effort to eat, could be one reason why people do not take enough of fruits and vegetables, even those who can afford them. Thirdly, finally, traditionally in our culture, vegetables and fruits are not really considered an essential item in the diet. They're considered more of an accessory, an optional, which may be added sort of like an icing on the cake, not something which is an essential item. So we have to change our thinking and conditioning and start considering vegetables and fruits also as an item of the diet in their own right. They're important in themselves. Now, a few frequently asked questions in relation to vitamins and minerals. Firstly, are fruits and vegetables interchangeable? As we saw a few minutes back, to some extent they are. Essentially, yes, because they both have very little calories, they both have more than 80% water, they both have vitamins and minerals in good supply. But then one thing important is that we should consume, as far as possible, seasonal, local, and fresh fruits and vegetables. The three go together. Only if they'll be seasonal and local, that they'll also be fresh and will have their vitamin and mineral content intact, and they'll also be less expensive. And if we go by Ayurvedic wisdom, the fruits and vegetables which are the best suited for a particular season will be available in that season. And instead of getting fanatic about one particular fruit or vegetable being very healthy, that common expression, very healthy, whatever it means, instead of getting obsessed with that, take a variety of seasonal and local fruits and vegetables. That's enough. One doesn't have to think too much about which ones I'm taking. Of course, broad principle is, as far as possible, colored vegetables, green leafy vegetables, red vegetables, yellow vegetables, and fruits, and so on. Green, yellow, orange, take a colorful variety of fruits and vegetables. Now, which is better, fruit or fruit juice? One rough answer to, crude answer to this would be naturally, because the fruit includes the fruit juice. Like that question, which is bigger, the rat or its tail? The rat is bigger because the rat includes its tail. But then going a little deeper, fruit is better than fruit juice because what we throw away, the remaining part of the fruit, also has something of value, particularly dietary fiber, some vitamins and minerals. So instead of throwing it away, if it is possible, take it in, including the skin of the fruit if it is edible. It is difficult to overeat if one has fruit. You can easily take the fruit juice extracted from 15 apples at one sitting, but you can't eat 15 apples at a time. Now, what are the implications? The implications are it's difficult to overeat if one has fruit, but with fruit juice, one can overeat, consume more calories than is necessary, consume more sugar than is necessary. More sugar, particularly because if it is a packed juice, you will find if you read the ingredients carefully, which are always in small print, it has very little fruit or rather fruit pulp, but plenty of sugar, water, and some preservatives to increase its shelf life. Even those which claim to be totally natural, in the sense that there is no artificial preservative added, even they at least have plenty of sugar and water. And instead of spending so much on sugar and water and very little fruit, why not eat the fruit itself? What is osteoporosis? Osteoporosis is a major public health problem and more common in women than in men, normally associated with age. Now let's see some of the important facts in relation to osteoporosis. Let's assume that it must be because of calcium and vitamin D deficiency. Yes, that is a risk factor for osteoporosis, particularly vitamin D deficiency, but that is not all. Why osteoporosis is important is because it leads to weakening of bones, and therefore it's very common for an old person to have a minor fall and suffer from a fracture, particularly the fracture of the neck of the femur. You know, the femur is the bone in the thigh, and at the top at which it is attached to the hips, the thigh bone, is the neck of the femur. That is a weak point, and that is where the fracture occurs, and that can be a major setback in old age, occasionally leading also to death because of some complications. So fracture of the neck of the femur is a major problem, and an old person also is always vulnerable to a fall. Like a child, old age and childhood is similar, except for the difference that a child has very body, you know, of the type that it can fall and still nothing happens. In a less than a minute, the fraction of a minute, the child is up and running around again. Adult can't, an old man can't, old person can't do that. Instead, the person may be bedridden for the next several months with a fracture. So that's why it is important. But then the risk factors are not just calcium and vitamin D deficiency. Sedentary life is a big, major risk factor. Regular physical activity helps in preventing osteoporosis. Smoking is again a major risk factor. So smokers are more likely to get osteoporosis than non-smokers. Very important point is that the prevention of osteoporosis should begin in youth, because after a certain age, one can only prevent the depletion of calcium from the bones. That's a part of the aging process, losing some calcium and minerals from the bone, which weakens the bones. That's a part of the aging process. One can slow it down, maybe prevent that to some extent, but cannot deposit additional calcium in the bones after a certain stage. That happens only when the bones are growing and developing. And therefore, the prevention should begin in youth, which means enough of the sources of calcium, vitamin D, enough of physical activity, and no smoking during youth. That is what will help in depositing enough of calcium in the bones and will prevent osteoporosis in old age. One important fact is that, of course, any type of physical activity is helpful, but what particularly helps, and this is important for young people, what particularly helps in depositing more calcium in the bones are weight-bearing exercises. Which means one which the weight is borne by that particular limb, maybe by weightlifting, or maybe the type of exercises given in physiotherapy in which even while raising a leg, you are carrying a weight along with the weights, you know, sometimes provided with sandbags and sometimes with just water bottles. One bottle of water also has 1 kilo weight. So weight-bearing exercises. Why? Because calcium tends to be deposited along what are called the lines of stress in the bone. And the lines of stress correspond to the part that is being stressed by weight. So weight-bearing exercises are more helpful than other types of exercises in depositing calcium and minerals in the bone. So weight-bearing exercises can be a good preventive. The most vulnerable periods are pregnancy and lactation, and therefore as a routine, supplementation with vitamin D and calcium during pregnancy is quite justified. I said during pregnancy and lactation, supplementation with calcium and vitamin D, supplementation with iron, folate, and B12, all these are justified. But in general, are vitamin and mineral supplements necessary or at least acceptable? This is a difficult question, and it will be difficult to have consensus on this. But a sort of a relatively dispassionate and simple way to put it would be, firstly, that theory and practice differ in this area. In theory, every doctor, every nutritionist will tell you that if you take a balanced diet, then supplements are not necessary. The best way to get all the nutrients, including vitamins and minerals, is to get them from a balanced diet, not from a supplement. But then the same nutritionists and doctors sometimes themselves take these supplements, which means that the practice differs. Not only they prescribe, they also take themselves, which means that while in theory, all of them say that it's not necessary, in practice, they prescribe and very often themselves take. So theory and practice differ very widely in this area. However, what one is to keep in mind is that may not be completely safe as one thinks, particularly when mega doses are taken, huge doses. So what I've been emphasizing throughout is take them by all means if you like, but do not take large doses. You know, when in spite of taking a fairly balanced diet, a person still takes a supplement, it is like an insurance policy. They say, you know, the intake of these substances is more through an intuitive sense that I'm taking enough, and a guesswork that probably it is enough. But you can never be sure. To be a little more sure, you take a supplement, the way you buy an insurance policy. But then it's quite possible that the supplement may not have the same nutrient bioavailable to the same extent. And it may not be really a substitute for a poor diet. In fact, it is not a substitute for a poor diet. So the diet should be balanced. In addition, one can buy also insurance in the form of a supplement. Just as, you know, getting a supplement, getting an insurance policy is not a substitute for living a healthy lifestyle so that you live longer. So in the same way, taking a food supplement, a vitamin and mineral supplement, is not a substitute for a poor diet. It is only an additional assurance that if something is missing in the diet, maybe this will take care of it. Another justification is quick action. As I saw that if you have a clear-cut deficiency, iron deficiency or thiamine deficiency or riboflavin deficiency, you give the specific nutrient alone or in a cluster, you'll get quick response with the supplement. It's also justified in states of enhanced need like pregnancy, lactation, soon after surgery, another illness which has made the person weak, but certainly by no means no mega doses. Not 60,000 units of vitamin D going on for weeks and months, not 200 milligrams of iron going on for months, or 500 milligrams of vitamin C going on for months. So no mega doses and not going on for long periods. Even if you are taking mega doses, stop them as soon as necessary. So avoid mega doses. Suggested reading. Again, this same book, Eating Wisely and Well. This material you'll find in chapter 5. The title is Small is Beautiful. And this is the place from where I'm speaking, Sri Aurobindo Ashram, Delhi branch. After the lifting of the COVID restrictions, we are open to guests, and you are always welcome here, just for the peaceful atmosphere of the place and participating in its various activities. And of course, we love to hear from you. Any comments or questions, apart from what you may ask now, you may drop the email to yes@yesspirituality.com. Gratitude to the Mother and Sri Aurobindo for making the event possible in spite of all the technical glitches we had in the beginning. And thank you all for a patient listening.
Thank you, sir. We can just take questions from the chat box. I'll just read out. The first question is, are basmati rice not good for health?
Once I had asked Dr. M.S. Swaminathan, who was then the director of the Rice Research Institute at Manila, Philippines, that the price of rice varies a lot, depending upon whether it's basmati or some other type of rice. The difference can be enormous. Is there any difference in the nutritional value? He said there's no difference in the nutritional value. The difference in the price is primarily because of the fragrance. I think that sums it up. So no rice is in itself good or bad. All rice is equally good. But then if the seed coat is intact, it is much better than when it is polished.
What animal foods provide B12?
It's particularly rich in liver, but that doesn't mean one has to take liver regularly because the requirement is very small. The requirement is hardly 1 microgram per day. So the requirement is extremely small. And therefore, one doesn't have to go in for the source which has the highest amount of vitamin B12. We can easily depend upon, if a person is a vegetarian, he can easily depend upon milk and milk products. If a person takes egg, then he can also supplement some with the egg. And apart from that, one can also get some supply of vitamin B12 also from the intestinal bacteria, as in case of vitamin K. And if one wants to be very sure, one can take a supplement, and an oral supplement is preferable to an injection, unless there's an acute deficiency.
Is vitamin C also an immunity booster? Was often prescribed as a preventive during epidemics in school.
Yes, vitamin C, like other antioxidants, can help immunity. And as we saw, this is something which Norman Cousins also figured out during his illness, that depletion of vitamin C from the adrenals could be probably weakening his immunity. So vitamin A, C, E, which are among the vitamins which are antioxidants, selenium among the minerals, these all antioxidants. One of the major systems that they affect is the immune system, because the immune system has rapidly dividing cells. Rapidly dividing cells require this antioxidant much more than other types of cells. So that is the logic by which all these antioxidants help in boosting the immune system.
Why do doctors prescribe vitamin B capsules with antibiotics?
Yes, because antibiotics would kill the germs in the intestine, and we saw some of the vitamins which we get are from these bacteria, and therefore one way to compensate for it, apart from the fact that the person may have enhanced requirements during an illness, one of the ways to compensate for it is to give a vitamin B supplement.
Next question is, milk contains so many vitamins and minerals, but it was mentioned in Ayurveda class that milk is not required in our diet. This is a little confusing. Should we take milk in routine or not?
Well, that is a difficult question, and as I think we discussed in an earlier class also, it depends partly on what type of milk it is and how you look at this milk psychologically. What type of milk? Is it milk which is coming from a single animal, an animal which has been looked after well, or is it a mixture of milk from a large number of sources, milk which may be adulterated? Adulteration of milk with urea, is not unknown, and that makes the milk look thicker and will give you a good malai. But what is happening is not extra fat, but it's some urea mixed with it. So what type of milk it is, and how much you trust that source, and how psychologically you are comfortable with the fact that this milk might not have come from a place where the cow was treated as a member of the family, but from a place where the cows were herded together under unhygienic conditions, and vacuum pumps were used to take out as much milk as possible. If you are comfortable with that, then ignore that, then milk is okay. So it all depends. But all the same, in Ayurveda, or for that matter, even otherwise, why it is said that one can do without milk is because children have been brought up on milk, without milk after the mother stopped breastfeeding, no milk after that. And one well-known example is that of Maneka Gandhi. She did that to her child, and the child has grown up quite well.
With respect to our discussion on vitamin D, please discuss the role of sunscreens. Some say we should not use it, others emphasize its use. Should we be using it or not?
You see, again, it's a trade-off between synthesis of vitamin D and sunburn. So if your skin is so delicate, which again can happen with fair skins, dark skins are not very sensitive to sunburn, not so sensitive to sunlight as to get sunburn. So while vitamin D synthesis will be better if the skin is fair, the sunburn is more likely, which means if the skin is fair, then shorter exposure or use a sunscreen. And best is probably not to depend too much on just sunshine for getting enough vitamin D.
Please explain difference between folic acid and folate. It is said folate is absorbed better, so what should be taken as supplement?
The supplements always have folate because the folic acid is the base. Once you make a salt out of it, it becomes folate. And in general, salts are absorbed better than the parent compound, which is still sort of unstable chemically. So, iron is also given as a salt, like ferrous sulfate, citrate, and so on. Calcium also is given as a salt. So all these are given as salts. And that's why they say that this much of ferrous sulfate containing this much elemental iron.
Okay. Fruits like apples and bananas are available throughout the year. When should we consume them?
Actually, a lot of fruits are available these days around the year, not because they are seasonal, but because they can be kept in cold storage and made available around the year. So one should think more in terms of when they are naturally available and grow in plenty, rather than just their availability in the supermarket.
How harmful is alcohol? Is there a safe amount? People in developed countries seem to consume alcohol regularly.
Well, not only in developed countries, that is a myth. There are both people who consume regularly in underdeveloped countries or less developed countries and in developed countries. Anyway, that apart, how safe is alcohol? In terms of strictly medical knowledge, less than 60 ml of a hard drink means less than 2 pegs for men and less than 1 for women. Women are less tolerant to alcohol than men. And this much alcohol may help in reducing heart attacks particularly. But then whether it is because of the alcohol or whether it is because it helps some people reduce their stress levels or whether it is because of the antioxidants present in some alcohols like wines, that is debatable. But what is not debatable is that a person who takes regularly that much amount, if he is particularly genetically prone to it, will get addicted to alcohol and the amount will go on increasing. He'll become more and more tolerant to higher doses. So he'll not be able to stick to the limit. And what is also not debatable is that if he crosses a certain limit, he may be able to prevent heart attacks, but he is sure to get cirrhosis of the liver. And therefore, in general, one does not really recommend alcohol for preventing heart attacks. If it is because of the antioxidant content of red wine, there are plenty of other completely harmless sources of antioxidants. And if it is to reduce stress levels, in yoga, we have much better, safer, and uplifting methods of eliminating stress. That is what this course is essentially about. So certainly, one would not recommend alcohol, therefore, for any of these reasons. But all the same, strictly medically speaking, up to a certain limit, essentially harmless. And the tolerance level is half in women as compared to men because the enzyme that metabolizes alcohol is in smaller concentrates, smaller amounts in women than in men.
There is just one last question. Is regular intake of vitamin B complex capsules prescribed for depression?
Not necessarily for depression. Many people take it even otherwise. As I said, just assuming that just in case the diet is not providing enough, let me take it. And if the person is depressed, that may give the person an additional reason. And if the person takes it under the impression that this will relieve my depression, it is likely to do that also. Because you might also, it may be an interesting thing for you to know that even when you give a proper antidepressant, a drug with a proven antidepressant effect, half the effect of every antidepressant is because of the placebo effect. It is because the person thinks that it will help me that it helps the person. So in the same way, if the person thinks that B complex will help my depression, even B complex will, because at least the placebo effect is there.
That is all.
Sorry, I'm giving away many of the secrets which may not be very nice for the layperson to know, because if you know that it is the placebo effect, it may become less effective for that person. But anyways, I feel that in this forum, which mainly has a small niche audience consisting of people who think and want to know things exactly as they are, I'm giving away all these things which may not otherwise be given away in public, because that is not in the interest of the patient to know that, well, the doctor has prescribed this and it might work because of the placebo effect. It is at least harmless as compared to an antidepressant, because antidepressants have side effects. A B complex has no side effects. So that's why not give something which has no side effects and is also likely to be effective.
That will be all for the questions in the chat box. So I think we can end the session today. So thank you, everyone. And tomorrow we will have the practical class on lying supine postures. And we end today. Thank you.
Thank you.